When I see the enormous struggle in countries like Canada to try and secure as many ICU units and ventilators as possible to support people who are struggling because of COVID-19, I can't help but think of Sudan. Last week, my colleague in Sudan told me that there are only 35 ICU beds available in the entire country, and almost all of those are in the capital city of Khartoum. About 1,000 kilometres from Khartoum is East Jebel Mara, a region of Sudan where care is providing vital water, sanitation, nutrition and healthcare support to communities that have suffered from 10 years of conflict. But for a person who gets sick from COVID-19 and lives in a place like East Jebel Mara, there's almost no hope that they'll get access to one of those 35 ICU beds or one of the approximately 80 ventilators that exist in the country of Sudan. Because of this, CARE is doing everything it possibly can to try and prevent the spread of COVID-19 in Sudan. We're doing this through pre-positioning essential protective equipment, through raising community awareness about COVID-19, and through trying to increase community hygiene, particularly in the refugee camps, the IDP settlements and the healthcare centres where we work. We're doing this because in a place like East Jebel Mara, prevention is really the only option. We can't respond to COVID-19 because there just aren't the relevant equipment, the facilities, the healthcare expertise that we need to respond. For example, in East Jebel Mara, the only thing we can do to respond to COVID-19 is construct small isolation buildings where people who get sick can go and wait, and they can either wait to recover or they can wait to die. That's the only thing we can do to help. Today, I believe that there are 6 confirmed cases of COVID-19 in Sudan, but because of the poor testing availability, it's likely that that's much higher already. We really need to do everything we can, both here in Canada and in places like Sudan, to try and prevent the spread.